My name is Kate Jackson, and I'm an assistant professor of community and global health here at the College of Health at Lehigh University. I'm so grateful for the opportunity to share a bit about my research journey since I came to Lehigh about 4 years ago. I can tell you that I never expected to be known as the trash lady or that professor who is always talking about trash, but here we are, and I couldn't be happier about it. From garbage to gardens, my research focuses on solving pressing environmental and community health concerns alongside the community here in Bethlehem, Pennsylvania. Using a community-based participatory research model, my work is full of surprises, it's rich in relationships and data, and positive impact. Real-world impact is what drew me to Lehigh. The promise of it, problem solving, collaboration, and lasting impact from the Lehigh Valley to across the globe. We don't do this work in isolation. And so I'm grateful for the opportunity today to highlight the power of community-based participatory research, or CBPR, and its role in producing meaningful, rigorous research. This model of research is a core component here at the College of Health as we work toward our mission to improve health outcomes and accomplish health equity, alongside the people who are most impacted. Real-world impact requires real relationships with those who have real-world knowledge. By real relationships, I mean lasting, fair, consistent, and reciprocal relationships. And by people, I mean those who have real-world knowledge, individuals and communities who have lived experience with the topics that we study every day. The community is not our lab or our classroom. The community is our home. It's where we live, it's where we work, and we share it with people who are deserving of long-term investment, people with knowledge, creativity, and expertise. In CBPR, the community is our partner, our co-investigator, our teacher, and we learn better together. I start each semester with my favorite quote from Dr. Leela Watson. And she shares, "If you have come here to help me, you are wasting your time. But if you've come because your liberation is bound up with mine, then let us work together." If there's one thing I've learned in my research of the environment, it's that it shows us how interconnected we all are, how dependent we are on one another. My health is connected to your health, and your health is connected to mine. To thrive, to be free, to really accomplish health equity, we don't simply help, we shape the world together. So what is CBPR? CBPR provides us a framework for conducting active, democratic, and equitable research. It brings together researchers and community members, people with lived experience and expertise in the pursuit of knowledge, that leads us to real-time, on-the-ground solutions to pressing issues. As the disability rights movement has taught us, nothing about us without us. CBPR is more of a state of mind. There are no specific methods. Projects can be quantitative, qualitative, or mixed methods. What makes CBPR unique is the centering of community. From deciding the research questions, to selecting the appropriate research methods, to integrating data and disseminating it, CBPR studies are rigorous, detailed, responsive, and tested in real time. CBPR is a framework for action. It is recognizing that community knowledge is irreplaceable, and complex social issues in our real world can't be understood in isolation. This type of research understands that trust and humility are necessary for doing the work, and that communities should have equal inclusion in identifying and addressing the issues impacting them. Collaborative research can positively impact all who are involved if done with intention, care, and CBPR methods. In our brief time together today, I will indeed be that professor who always talks about trash, because even though I expected to study pollution or climate change when I got here to Lehigh, I quickly learned that what residents wanted to address was trash. Trash is visceral. Trash represents the things that we don't want. It smells, it attracts pests. And in a city of 80,000 people, Bethlehem is unique in that it doesn't provide waste management services. Rather, each household contracts its own hauler. In our research, we've identified over 26 different companies that all operate independently here in Bethlehem, which means that every day is trash day. On the south side specifically, issues of density and turnover complicate things. So, using CBPR, I began by listening and showing up. At meetings, city council, cleanups, events, and I built relationships with my neighbors. And I followed the lead of trusted community leaders. The ask was clear: help us understand and to act. And so our response has been broad. It began with my first CBPR class in 2023. We worked with community partners like Community Action, the City of Bethlehem, and passionate residents. And the project has since evolved into a social impact fellowship here at Lehigh. We've built community partnerships, co-hosted listening sessions across the city. We've spent 2 years collecting data, interviewing over 60 residents here in Bethlehem, doing walking audits, and participating in community events and cleanups. We've done neighborhood organizing, and we are compiling a report and a website that includes comprehensive trash concerns, community-identified solutions, case study analysis of similar cities and their policies, ordinance summaries to help residents understand trash concerns and procedures, and we've created a pilot program with residents in the Indian Hill neighborhood called Adopt a Spot, which will allow neighbors to adopt a spot in Bethlehem that they pledge to care for, while also connecting residents who have similar concerns. Our early findings on trash have included the emotional burden, the financial burden, the physical burden of trash, and also the root causes of trash buildup. We know that trash is systemic. It's not an individual behavior or problem, that we have issues with limited resources and enforcement, and the cost is a barrier. We know that increasing density and the housing crisis, as well as environmental, wind and density, can actually increase the amount of trash we see. We've found that perceptions of trash vary, but that major themes are that rental properties are seen as a problem, and that people internalize trash as a means that people just don't care. And also that residents perceive that traditional values of community are gone. We've also found community solutions like policies and oversight, and community care, education and stewardship, investment in things like the Southside ambassadors and composting and recycling are all of interest to residents in Bethlehem. As we continue to shift through and compile the report and pilot the Adopt a Spot program, the impact is already clear. I like to say that with CBPR, the process is the product. In doing the work of long trust building and leadership sharing, collecting data together, coming up with solutions together, we see something unique. We see hope. Impact begins as people feel seen and valued. As co-researchers, community members build capacity to create change. We've seen this in the birth of a neighborhood association, residents who met through this research project, who now hold their own monthly meetings to talk about environmental concerns like speed bumps and tree canopies and block parties. And we've seen students who are learning a multitude of research methods, mapping, interviewing, coding, but also how to be a responsible community member, how to build reciprocal relationships. In fact, the city has also adopted this project as an official part of the Climate Action Plan. This is so important because CBPR is critical. We need research that focuses on rebuilding energy needed in communities and making change, and moving us beyond sheer survival to become a means of restoring health and prosperity to our people. Capacity building is a critical part of CBPR. Communities should be made stronger through the research project. Research can energize communities to actively engage, to advocate, to create solutions, and take the lead in sustaining them, which is what lasting impact is all about. My CBPR journey has also included a partnership with Brockle Middle School, our neighbor here at Lehigh, and Community Garden Coordinator Nia Watson. And this was made possible by a faculty innovation grant here at Lehigh. This project meant we created an original curriculum, collaborating with local students to celebrate local culture and honoring students' stories and relationships with plants, land, and food, while restoring mental health. At the end of the year, students were able to grow 100 plants and pass them on to our local community, who cared for them in the MLK Community Garden, ultimately sharing fresh food with the entire neighborhood. My journey has also taken me to responding to the local housing crisis. Because CBPR responds to real needs in real time, I've been able to partner with local nonprofits, government agencies, and advocates to respond to the housing crisis here in the Lehigh Valley. Students in my CBPR class became partners in data collection and analysis, and in co-creating an interactive magazine to encourage action. With CBPR centering community needs, honoring expertise and experience, building trusted, lasting relationships, expanding our understanding of the world around us, and the possibilities for meaningful, lasting change are endless.